this lecture. Okay. And next I'll talk about how you do the diagnosis. So you have to understand the disease and what's the defect in your gene in order to do the molecular diagnosis of this disease. Cystic fibrosis is the first genetic disease that's been, the gene's been sequenced. And I will talk about how they discovered the gene and who did it and what is the strategy they use to do the gene therapy. Okay. Currently, there is no cure for this disease. Although this is the first, disease that's found the defective gene and you sequence the gene, but they don't have any good treatment at this time. Cystic fibrosis, the name for the disease, coming from the patient's pancreas has a lot of fibrotic cysts, and they thought that's the metabolism disease. Melvin! Yeah. I just started, so. Well, you can have the handout. A revised schedule from last week or the week before, and your guideline for your oral presentation. So cystic fibrosis, that's the Chinese name, 囊肿性纤维化. Yeah, 纤维化 means fibrosis. Okay, that means somewhere in your organ should be a lot of soft and bouncy extracellular matrix, and it's become fiber-like. Okay, so fibrosis of any organ will limit the function of the organ. Sometimes it's for a lot of organ is a sign for the disease. Okay, or a sign for inflammation. Got it? Okay. So today I will talk about what are the clinical characteristics and introduce the disease-causing gene, CFTR. The story coming from 18th century, okay? Long time ago. This disease was discovered in Europe first because a lot of children, they taste salty. So there's a saying in Germany and Switzerland, they say, those children when you kiss the children, and if their forehead tastes salty, he's bewitched, means he's cursed, and he will die soon, very soon. This disease was discovered by a nun. So the nun was working as a volunteer in a hospital, 18th century, and then she met this mother and son. This children was about a year old, and the child was crying all the time. So the nun came over to the mom and said, "Oh, she wanted to do some blessing to these kids to see whether she can calm him down." So she kissed his forehead, and then she found that child, the forehead of the child tastes salty, really salty. Okay. Unfortunately, that little kid passed away pretty soon. And that was something they discovered in the early 18th century. In 1905, this doctor, Carl, he identified children with this disease is inherited. That means this is an inherited disease. That means somebody in their family had the same disease. Okay. For example, the first baby discovered, the first salty baby, someone in his family, I think it's his aunt or his grandma, has the same disease. Also passed away very, very early in their age. And then Falcone is the person found the link between pancreatic disease and the salty skin are two major signs clinically that you can just check if they have salty skin. They must have something wrong with their pancreas or a GI problem. And most of the kids with this symptom pass away before 2 years old. Okay. Sometimes they found adult has the same problem. But if you can survive through your teenager or adulthood, your clinical symptom is milder. So we'll talk about that next week, okay? Dorothy Anderson, she's the first person. She wrote a report on this disease, and she coined the disease cystic fibrosis, meaning she found the genetic link to pancreatic cyst and in the kids with the salty forehead. Paul St. Ignace, whatever, I don't know who he is. He's the person actually follow a group of family that with this disease, and then he said this is an inherited disease. I will give you more story on how these doctors discovered the gene later. Okay, so these are clinical found symptoms and characteristics that lead to study cystic fibrosis. Okay, so the definition for cystic fibrosis is it is an inherited disease. And this disease is caused by thick, sticky mucus that build up in the lung. Did I ever talk about the lung at the beginning? No, because most of the autopsy they found from the patient are cysts, fibrotic cysts in the patient, but they died because they couldn't breathe. Okay? That is because the mucus is built in the lung. The lung has, unless you look at the morphology of the lung. If apparently it's a lot of cysts on the lung, then it will say cystic fibrosis of the lung. But it's a cystic fibrosis of pancreas that was first discovered. Then they later found that all these patients, they died because they couldn't breathe. And there is a very sticky, thick mucus built in the lung. So that's something they found later, like in the 19th century. The cystic fibrosis, well, this is the symbol for the disease, cystic fibrosis. Just like pink ribbon is the symbol for breast cancer. So cystic fibrosis is the symbol for cystic fibrosis. And it's coming from a patient, a kid. He was overhearing his mother talking to somebody. And she said, oh yeah, my kid has cystic fibrosis. And the kid was like 4 years old or 5 years old, and he couldn't understand what is, and he couldn't pronounce cystic fibrosis. He thought his mom was saying something like cystic fibrosis. So that's become their symbol, okay? Okay, so cystic fibrosis, we will talk about how they discover the defect on the gene, but I'm just telling you the fact, okay? That is the autosomal recessive disease. Do you know what is autosomal recessive? Do you know what's recessive? Do you know what's dominant? Okay? Do you know what's autosomal? That means it's not sex-linked. Okay? So if you try to remember your genetic, the inherited pattern mainly has two different types. One is autosomal inherited pattern. That means your DNA in all your cell, or is sex-linked, it's either on the X chromosome or Y chromosome. And if you have one defective gene and cause one defective allele cause the disease. That means this disease is autosomal dominant. And if you both copy of the gene are defective, to get the disease, that means the disease is autosomal recessive. Okay, so you have to your genetic now. Just very simple genetic. And cystic fibrosis is a common lethal inherited disease, meaning if you have the disease and you're dead, you're doomed. Okay, so it's common in Caucasian. Do you know what's Caucasian? White people. I mean, most of the human coming from Caucasian, that area, that's the origin of the most of the European or the white people. But this disease is not common in Asia, so we never heard about it, right? It's not uncommon. When we talk about the defect of the gene, we'll talk about the defect of the gene later today or next week. Okay? We have different type of mutation in comparing with the Caucasian. Most of the defect in Caucasian are lethal, but the mutation that affecting Asians are not so serious, but it could affect some of your major physiological condition sometimes. Okay? And we will introduce all these physiological conditions, how this gene is affecting your kidney or your lung or your endocrine system. Okay? And in Caucasian population, the incidence is 2,500 over 1 over 2,500. Okay? That means the carrier frequency is 4%. So do you know how to do the calculation? The carrier rate. There's an equation. You need to know how many people in your population and what is the incidence, and then you can get the carrier frequency. What does that mean? For every 100 person, there are 4 person carry this defective gene, just one copy. Okay? So if they marry another person with another defective copy, their baby will be cystic fibrosis. So that's it, yeah. So 4% is pretty high. Do you know what is the most common inherited disease in Taiwan? Dun, 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 dun.
Diabetes.
No, that's not inherited disease, or that's not a genetic disease. Okay, that's a metabolic disease. Thalassemia. And do you know what is thalassemia? Specifically, it's beta thalassemia in Taiwan. carrier rate for beta thalassemia in Taiwan is 25%. So yeah, it's pretty high. We did the screening in 20 years ago. It's about 25%. There are 4 copies of your hemoglobin chain, and 2 of them are beta chain, right? But there are different type of mutation. Even though the carrier rate is really high, but you won't get the chance you're getting the same defect and it marry the same guy to get 1/4 chance of the thalassemia patient is really low. Okay, that's because there are 4 copies of the gene, and in addition to 4 copies of alpha and beta hemoglobin gene, you also have a lot of pseudo gene, and sometimes the pseudo gene can be reactivate and compensate your defect. So even though carrier rate is high, but you don't see a lot of lethal patient, lethal inherited disease running around in Taiwan. But a lot of students or kids may have anemia. So if they go hiking or playing around outside, outdoor, sometimes they faint very easily. Okay, so what is the most common inherited disease, not lethal, inherited disease in your country? And do you know?
I think the same.
The same? Thalassemia? Really? Yeah. Probably we have the same ancestor, right? Okay, so cystic fibrosis is a single gene disease. Do you know which disease is caused by multiple genes? Multiple gene, yes. It's not that hard. Cancer. Cancer. The disease caused by at least 10 different genes. Unless the defective gene is P53 or one of those very important tumor suppressor gene. Okay. Most of the cancer are defect of multiple genes. So in order to have the result called cancer, you will have stage 1, stage 2, stage 3. Each stage you need have the specific gene defect. When we talk about cancer later, I'll tell you, the story of this multiple gene. This gene is called cystic fibrosis transmembrane conductance regulator. In short, you take the first letter from all these important words, CFTR. Okay. They don't put C here. It's not very common. You have five letters for your gene. Okay, so most of the gene shorts are in 4 letters. The CFTR is located in the apical region. Do you know what is the apical region? Of your exocrine epithelial cell. So do you know the orientation of your epithelial cell? Do you know what's basement membrane, right? So the cell will sit on basement membrane. The top of the cell is the apical region of the cell. That is facing the lumen of your organ, for example, GI tract. Okay? So that's where your food is passing through. If it's your lung, that means that's your airway. So the apical region will be facing the lumen of that specific organ. Okay? And the porting of this gene is an apical region. So remember that because it's very important. The gene is discovered in 1985 by Dr. Francis Collin, who also sequenced the whole gene and leads Sequencing Institute in United States later. He's kind of very famous. Next week I'll tell you more about Francis Collin's story. And the gene is located on chromosome 7q31.2. It's not 31.2, please. This is called 31.2. So this is the ideogram. Do you know what is ideogram? It's a cartoon structure of your chromosome. You will have bending. Bending is a result from staining, specific stain on your DNA, your chromosome. And for each visible bending under the microscope, you can name from this is Q arm, this is P arm, and each visible band will be 1, 2, 3, and this is 7q31.2. It's not 31, it's 31. So the name of the gene product is cystic fibrosis transmembrane conduction regulator, and the gene is sitting on 7q31.2. The gene structure, it is about 2,500 kilobase pair long. It's a pretty big gene, and it has 27 exons. That's about the average size, or maybe a little bit longer. And the messenger RNA is about 6,129 base pair long. That translates to a 1,480 amino acid. So the molecular weight is 168 kilodalton. That's pretty big. How big is that? It's on the top of your jaw. If you're running a 10% jaw, it's probably on the very upper level of your jaw. So that's pretty big protein. And the protein function is the chloride channel. Holy moly, it's a chloride channel. That's a very important channel since it's located at apical region of your lumen, right, of your epithelial cell. And it's involved in the regulation of other transport pathway. Okay. So, what happened to this? Oh, there we go. Oh. So the instant in different ethnic groups is different. In African American is about 1/1500, and Asian American is 1/3200. In Asian, is very few cases, and most of this Hispanic in California. Although the incidence is about 1/10,000, but they have very different clinical symptoms in comparing with Native American, not Native American, the Caucasian. And in Taiwan, there were 6 cases, lethal cases, but there are a lot of minor mutation found after year 2000. Before year 2000, there were only 6 lethal cases. After year 2000, you have maybe more than 100 minor mutation that was found since the technology of the DNA technology is, is improving, and a lot of DNA chip for screening the cystic fibrosis is available. So we found Taiwan has a lot of mutations that are minor. The first case was discovered in Taichung. The first 2 cases, Taichung Veterans Hospital. You know that the one in across street from Donghai University. You know. You know. Well, you can take them to Donghai University. It's a very nice campus. It's pretty. Yeah.
So far away.
Or if you take the train and then you transfer to the bus. Would take about 40 minutes. 差不多吧 40 minutes. He has a bike, motorbike. And it was discovered by my sister, my older sister. So that was a fun story though. She was doing her internship in Taichung Veterans Hospital. And that time she was pregnant, her first baby. So she has to go to bathroom all the time. And then she was taking care of one very special kids that's been hospitalized for at least more than 1 month. And nobody's know what happened to this kid. It has fever, the electrolyte of this kid was like, it's a mess. So since she was pregnant, she ran into the bathroom. When she was in the bathroom, she was reading, some of the journal. And just happened, she was reading Cystic Fibrosis. And then she started to see some similarity between that paper and her, her patient. And then she brought up this hypothesis or this doubt to her, her mentor. And then she said, well, why don't we test these kids using one of diagnostic tool we're going to learn next week called skin patch to measure the electrolyte. And they found those, not just one kid, there are 2 of them, brothers, have the same problem, cystic fibrosis. And they cannot do anything about it because it's a lethal inherited disease. Yeah, but at least they know what's wrong with these kids. So the parents, if they wanted to have a second child, they can do the prenatal diagnosis before they wanted to put the embryo into mom's stomach or not, right? So that's an instant for this disease. And that's the structure of the protein. It has 5 main domains. There are 2 transmembrane regions called MSD1 and MSD2. Remember, it's an apical region. So this protein is sitting in the membrane, okay? Wall, transmembrane. And there are 2 NBD domains. Nucleotide binding domain, okay? 1 and 2. These 2 domains are facing inside the lipid bilayer. I mean, they are in the cytoplasmic domain. And the NBD domain is binding to ATP. So this protein is utilizing ATP as energy source to do their job. So what is their job? The function is chloride channel, right? So somehow this structure will allow the chloride ion passing through. In your GI tract or your sweat gland, your skin, the chloride ion is going this way, outside. So what happens when the chloride ion is leaving the cell? What happens? Some of the water will come with it, right? Yeah. If you have a lot of chloride ion is going this way, and a lot of water will be losing from your cell, what happened to your skin? Wrinkle, right? And what happened to the top of your skin? You will have chloride salt crystal that is gathering on the top of your lipid bilayer. That's why when a nun is kissing the baby, and she said, this is a salty baby, because it tastes sodium chloride on the forehead. And there is a very important 1, 2, 3, 4. The 5th domain is this R domain. R domain is a regulatory domain. It is sitting in between these two nucleotide binding domain, that's blocking anything coming through this way, right? So how does this protein work? Do I have a picture? Oh, yes. So this protein kinase C, when it receives signal from somewhere else, it will phosphorylate this regulatory domain. The phosphorylated form of this domain will change their conformation and no longer allow it to sit in the middle. And these two transmembrane domain and this nucleotide binding domain will open it up, allow the chloride ion going through this channel because nobody is blocking them. Is that okay? So regulatory domain is important, right? So what is the most common defect on this protein? Take a guess. Well, PKC is important, right? Regulatory domain is important, right? And these two are also very important. The transmembrane domain are not important because it is an integral, it is the transmembrane region inside the phospholipid bilayer. So it will not have a big impact, or any alteration on these two regions will not have a big impact on this channel. So defect on nucleotide binding domain or the regulatory domain will decide whether this channel will be open or closed. Is that got it? Okay. So that's when the chloride ion is leaving the cell this way. So this is the lumen of your organ. For example, this is your respiratory tract. That will be your airway. And that's the lung epithelial cell. Chloride ion will be going off to this way. When it's going to this way, water is going out with it. Okay? That's how you keep your epithelial cell moist. The moisture is good, normal concentration or normal amount of water is good for your epithelial cell because the mucus can prevent bacterial colonization. And it will assist the cilia or remove whatever garbage that is sitting on top of the apical region of the cell. Okay? But when you have too much of the mucus, when it's building up, it also restricts the movement of your ciliary structure and is clotting the lumen. That's the problem with the cystic fibrosis. Okay, so that's the apical region here. This is the cell, and that's your nucleus, and your endoplasmic reticulum, your Golgi. The reason I'm saying this is because I want you to think about what happened to particular mutation, okay? And this protein is sitting in here, apical region of the cell. This is your lumen. So the function of this protein is not just regulate the chloride ion going out to the cell. It also regulate bicarbonate secretion. So if the cell is pumping out the chloride, the sodium ion should be absorbing into your cell. And the water is going out with the chloride, so you have mucus secretion. Okay. So how does the protein get to the apical region of the cell? How?
By the transporting from the transporting molecule
your gene is right here. The defect is on the gene, right? So how does the protein get on there? Going through ER, going to the Golgi, and excrete out. Okay.
Oh, yeah.
So it's going to by the secretory pathway. This is called the secretory pathway. That's the normal pathway. If you have protein going, if you have ER protein, Golgi protein, or any endosome protein, even the membrane protein, is delivered through the secretory pathway. If you have protein in your I don't have mitochondria here. Your mitochondria or your lysosome. That is something. Lysosome? Not lysosome. Peroxisome. Lysosome is splitting out from Golgi. Peroxisome and Golgi are independent organelle in your cell. So any protein that is going to that particular compartment should be delivered to that compartment post-translationally, not going through the secretory pathway. Most of protein are synthesized in cytosol, right? Only protein is going to be excreting out or going to these compartments are delivered through the secretory pathway. Okay? So that's your cell biology. Okay, we will come back to this figure later. Okay, just think about what happened if you have defect in the protein. The chloride ion is going out like crazy. Okay, so where do you have this CFTR protein? All the exocrine gland, right? For example, your sweat gland, your skin, nose and paranasal sinus. Number one, your airway, your lung, liver and biliary tract, your major digestive gland is a huge exocrine. Stomach, pancreas, intestine, vas deferens. These are affected by the CFTR mutation. So I will go through each, if mutation found in each one of the organ, what will happen to this organ, okay? Oh, the major mutation, there are more than 1,000 mutations discovered. Several biotechnology companies in the United States have DNA chip for screening CFTR mutation because it's a very common inherited disease in Caucasian. So they have a huge market in the United States, but not in Taiwan. The DNA chip harbor about 80 something to 100 point mutation. Not all of them, because we have more than 1,000 mutations described. Most of mutations that are found in Taiwan or in Asia do not have commercially available screening kits to do the DNA test. So most of them will be analyzed inside the hospital. And I will introduce a couple methods that we do the molecular biology of this gene, okay? One of them you should know is the PCR, or the sequencing. And that will be part of your homework next week, okay? There are certain mutations, the major mutation is delta F 508. That accounts for 70% of the mutation found. Certain mutations occur more frequently in particular ethnic group, but if the effect of the mutation do not cause a huge problem for your normal physiological condition, you will not think that's a mutation, right? You will not think you have a cystic fibrosis problem. There are mild defects for this CFTR mutation that are not discussed frequently. Commercially available genetic tests screening for at least 30 most common ones. Most of the DNA chip has at least 80 something to 100. And the 31 most common one referring to the Caucasian, not for us. So the Delta F508 is located at here. Got it? So this is on the nucleotide binding domain 1. And that's where your regulatory molecule can sit in here. And that's where they decide you should open the channel or close the channel. So why is this spot is a hot spot? There is no speculation and they couldn't find a reason for why this is a hot spot. It's just bizarre. At least 70% of patient has this mutation. So we'll come back to this. I wanted to think about what else could be wrong with this CFTR. That's your secretory pathway, right? So what would happen that also give you abnormal secretion of chloride ion besides defect on your channel? What would happen? For example, if you don't have transcription, if you don't have translation, do you think you will have the protein sitting on the apical side? No, right? So it's not just a point mutation, something else that is regulating the transcription or translation of this CFTR gene might also give you the same result, right? Okay, there are other things that may give you cystic fibrosis too. But we'll talk about that next week because it's over 1 o'clock already. What time is it? Oh, 15. So the mutation that will cause the skin will have excess salt in your sweat due to abnormal secretion of chloride ion by your sweat gland. So that's the salty baby story. The lung and the respiratory tract is the major organ that affected by this mutation because you cannot breathe. If the chloride ion abnormality happen in your GI tract, what happened to you? Diarrhea, right? Or any kind of GI, you're suffering from GI abnormality but that won't cause your life, that ASAP. But if you have something clotting on your airway, you cannot breathe. That's something very serious. So lung and respiratory tract has a very thick mucus and also cause a lot, because you have very thick mucus, you have a lot of bacteria can colonize in your respiratory tract and cause the infection. And bacteria will become more resistant to antibiotic because you are trying to treat the patient with antibiotic. And bacteria that colonize in your respiratory tract will become resistant, and that make this disease even hard to treat. So this is the sagittal section of your lung. Do you know what's sagittal section? Do you know what's cross section? Cross section is horizontal. Sagittal section is vertical. Okay, so that's the sagittal section of the lung. The one on the left is a normal lung section. The one on the right is the lung tissue from cystic fibrosis patient. So this is the one of the respiratory tract should be clear like this. And for this one, you have a lot of it's reddish, and you have a lot of small white pus, and you cannot see a very defined respiratory tract in this lung tissue because it's been clogged by the mucus. And the white little pus or cyst are the site where you get inflammation because you have clotting of your respiratory tract, you have bacterial infection, increase your inflammation, and that will cause fibrosis of the tissue. Okay, so that's the sign. That's why you see a very reddish tissue in the patient, and that's the H&E staining of the lung tissue. Do you know what's H&E staining? It's one of the histology technology that you stain the tissue and is edge of. Next time I'll tell you more. H&E are two different dye. One of the dye, H, will stain in blue or purplish. That means where it will bind to your nucleotide. I mean, where your DNA is located, you will get purplish or bluish. And E-eosin, this dye will bind to your extracellular matrix or your cytoplasm. So if you have collagen or if you have your cytoplasm, it will get pinkish. So this way you can tell where is the cell, which cell has a huge plasma, huge cytoplasm, or which cell has a huge nucleus. And this is a section for lung. This one, for each one of the tiny little bit space, these are the air sac. Okay, and yeah, the air sacs right here. This one is bigger here. This is the one air sac. Okay, this is the air sac, and this in here, this is the air sac. Okay, the air sac is lined up by a single layer epithelial cell. Okay. For your experiment, we have the cell line, these two B. Okay, that's a normal lung tissue. That's an epithelial cell. And this one has two different colors in here, right? So apparently this looks like some kind of, a lumen. There's a hole in here. The purplish lining are epithelial cell of the lumen. That's respiratory tract epithelial cell. And the pinkish ring outside the purple color, those could be the muscle for your contraction. It could be your extracellular matrix underneath your epithelial cell. Okay, and that could be very thin. Should be very pinkish. If you see a lot of purplish dots in your extracellular matrix, that means you have immune cell infiltration into that section. So this one is your airway, your lumen is right here. And it's very pinkish and purplish in here. That's mucus built up in here. So if this is your airway and you're standing like this, you cannot breathe at all. Air cannot go through it. This one here, that's a small arterial. I'm not too sure, is that artery or might could be arterial. And for your pancreas, you will have malabsorption caused by blockage of pancreatic duct. Same thing, the duct, pancreatic duct is where the pancreas secrete the enzyme generated from this organ that will help your GI tract to do the digestion. And so blockage of the pancreatic duct will prevent these enzymes, and if you don't have these enzymes, you will have this nutrition. Anything you eat will not be converted to, the nutrient you needed for your body. So you'll end up with pancreatic insufficiency. This is the pancreas. Also, it's the H&E section of your pancreas. On the left is the normal pancreas. On the right is the cystic fibrosis pancreas. This is the lumen inside the pancreas. That's where your enzyme is released into, and then sending out to your common bile duct, where you have pancreas and bile duct and your liver that is merging. And each one of them, this is the islet of Langerhans where you have your insulin. Okay. On the right is the pancreas from the patient. So you'll see, number one, you see a lot of white area. These are not air sac from your lung. These are fat tissue. Okay. The reason you have fat tissue is you see fibrosis. This is the fibrosis because it's pinkish. The fibrosis of the organ, making your organ is shrinking. So what happens if one of your organ is fibrosis and shrink? It create a space in your body, right? And the fat cell will live in there, go in there, and accumulate a lot of oil drop in here. The same thing happened to your muscle. If you have muscle atrophy, for example, you suffer from nerve damage of your leg, okay, your sciatic nerve, and if you don't have nerve innervation for your thigh muscle, the muscle will become atrophy. That means it's getting smaller and smaller, and it's going to create space inside, your between your skin and your muscle and your bone. At the beginning of your muscle atrophy, your thigh will get thinner. But if this condition is continued for a while, the fat cell will come into this area. You have a pseudo thigh. I mean, it kind of get bigger than you had before. The thigh will get bigger than you had before. It's called pseudo thigh. Is that a name? I forgot. Okay, so this is you can see the mucus is building up inside the lumen of the duct. Okay, that is the mucus. Okay. For intestine, obstruction of the intestine in newborn all the time. So the baby was born with a lot of stool inside your stomach. they have problem passing out those stool. And the condition is called meconium ileus. Okay, so you have, because your stool is thickening, has a lot of mucus, and it's too hard for this newborn baby to passing out. Oh, I think I have a picture of that. Not this one. Here. So this is the X-ray of a baby, and this is the stomach area. Did you see a lot of circle that is transparent? Those are where your intestine. That's where your intestine are, and you can see all these obstruction of your intestine, and that's what happened to the newborn baby. And in the colon, your large intestine, you will have on the left is the normal histology of your the colon section. So the colon has a lot of goblet cell, normally secrete mucus, help you to pass out your stool, right? So you'll see a lot of kind of a bubble in here. On the right, you don't see distinct structure of these creep, because all these space are occupied by your mucus. This is mucus. All these are the mucus. And that's mucus too. And it starts to get fibrosis at some time. So that's sticky mucus secretion in cystic fibrosis patient. This is the last one. So if the patient has cystic fibrosis mutation, it also will affect for the male their vas deferens. Does it affect female reproduction system? Sometimes, not all the time. The vas deferens mutation in CFTR affect vas deferens will cause infertility in all the male. Most of Hispanic population that has cystic fibrosis, majority of their mutation do not cause life-threatening symptom. For example, clotting in your lung or your respiratory tract. But most of them has the mutation causes them infertile. And when they go to IVF clinic, ask for help, the doctor exam their endocrine system, and they found that structurally nothing is wrong. And they also have sperm. The problem is with where the sperm should go into your urinary system is clotting by all the mucus. And that's what happened to a lot of Hispanic patients. It's not common in Asia. It's not. But if I say there are 100 cystic fibrosis patients in Hispanic population, there will be at least 50% of those it has problem with the vas deferens. Okay. So this is the histology of the vas deferens, and this is the lumen. This is the normal one. This is the patient's vas deferens. You can see the clotting of the lumen very, very clear. Okay. So, that's it. Shoo! It's about time. 1:30. So next week, I will start to talk about how do we do the molecular biology diagnosis. I just introduced a couple clinical histology to help the doctor diagnose this disease. And next week, we will talk about how they found the mutation and how did Francis Collin sequence the gene. Okay. So that's it. And next week will be here at 1 o'clock. Okay? Please do not come here at 12:30.
Thank you. I have one question.
You have